audio is appearing twice. If you
Actually, I'm hearing it once only.
Mutasem, play the video.
Sorry, doctor?
Play the video.
I played, okay.
There are various causes of medicine wastage, such as
Kind of echo.
Yes.
Actually, I don't have an echo. But Dr. Zakaria, in case that Dr. Mu'tasim, he started to share his documents and his video, I think you should mute everyone except Dr. Mu'tasim.
Okay.
I see.
This is, this will prevent the thing that of echo sound for everyone.
That's fine. I can do that from my side.
Yeah, that's it. So let me call Amal for the video for the YouTube live.
Yeah.
Okay.
Okay. So Mutasem, I'm going to make myself the presenter now.
Okay, that's fine.
So just have your slides ready on the desktop open for when I introduce you.
Okay, fine. Can you see that, Dr. Wright, from the beginning?
That's fine. So all the files that you'll be presenting, so both of your videos and your PowerPoint, just have them open on your desktop so they'll be ready to present.
Yes, sure.
Okay, that's fine.
And now, Dr. Zakaria, we are live on YouTube.
Perfect. We'll begin sharply at 12:30. So we have some of our participants that's beginning to join us now.
Sure, no problem. Yeah, we now have 4 attendees in advance. And I will check now the video, the live feed of YouTube. I'll check it now.
Doctor, now I can see my PowerPoint, but I cannot see you. Is that fine?
So Mutasem, can you turn on your camera?
Okay. Is that cool?
Yeah, that's good. That's good.
All
so
right.
at the moment, you're not the presenter, so you're unable to share your slides with.
I see. I got you.
Nice big office, Zakaria.
Thank you. They gave me a TV, Dr. Hisham. Did you get a TV as well?
Big meeting room, and I think view, nice view, and you should teach me how to do it.
So here on the top you have audio and video, and you're able to change the options from there.
Ah, okay, I got it. Okay, audio, video, and then
Change back.
Okay, perfect. Now we are live on YouTube. The connection is good and the feed is very good. Let me see how many viewers we have already. Just me.
Osama, should we leave it a couple of minutes before we start?
Up to you, Doctor. You are off to go whenever you want, so it's up to you. Now we are at 12:30 sharp. I think we can wait like 2 minutes until the faculty, if they have another meeting, they can wrap it up, or the students. We have now 9 attendees already have joined. Increasing, 10 and increasing.
Excellent. So welcome everybody. We will begin today's presentation in a couple of minutes. So thank you for joining us.
I apologize, just a quick advice. When we start the event or the outreach, please make sure that anyone who are not supposed to say anything, you can just make sure to mute the device that you are in, so we cannot have like an issues with the voice or an echo, or it will cause any corruption for the display or the moderator of the event. Thank you so much.
Thank you, Dr. Shah.
Okay, I think we should start now. So good afternoon, everybody. Assalamu alaikum. My name is Dr. Zakaria Nazar from the College of Pharmacy here at Qatar University. Thank you for joining us this afternoon. And welcome to our first virtual public health campaign hosted by College of Pharmacy here at Qatar University Health. So today's outreach campaign is focusing on the correct disposal of unused medicines. So we're calling this campaign the Safe Use and Safe Disposal of Medicine. So before we start, I want to say thank you to our Community Outreach Public Engagement Committee, headed by Dr. Mona, under the management of our Dean, Dr. Mohammed Diab, here at the College of Pharmacy, for arranging this event. So thank you very much for your efforts. I would also like to welcome our participants joining on YouTube. So throughout today's event, you'll be able to type in the chat, both on WebEx and in YouTube. We encourage your participation, your questions. So please feel free to get involved. So today, how we're going to be running the event, we will begin with a short presentation from Dr. Mu'tasim Mekke. He's a scientific researcher and PhD candidate at the School of Pharmaceutical Science in the University Sons in Malaysia, and his research is focusing on medication waste. We'll then have a panel discussion. So we have two prominent speakers joining us today that have some expertise in the topic of medication waste, at which point we'll be accepting your questions. We'll be putting the questions to our two panelists, and including Dr. Mu'tasim as well. So you can use the chat on both YouTube and WebEx to type in your questions. And our panelists today are Dr. Derek Stewart, Professor of Clinical Pharmacy and Practice here at the College of Pharmacy, and also the Director of Academic Quality at Qatar University Health. And we have Professor Hisham Qureshi, Professor of Pharmaceutical Science here at the College of Pharmacy at Qatar University Health. So just to introduce you to today's topic. So as across the world, there is an increasing use of medicines to treat disease. However, according to a recent World Health Organization report, over half of all medicines are either prescribed, dispensed, or sold are inappropriate, and half of all patients do not take their medicines as directed. So consequently, this has a negative impact on individuals' health and results in expensive waste of an important resource, which is medicine. Further, the way that medicines are commonly disposed of is increasingly having a negative effect on wildlife and ecosystems. Hence, bringing this topic to the discussion table today, and raising awareness of this topic. So to talk further about this and to present with some current facts and evidence, we have Dr. Mu'tasim. So Dr. Mu'tasim, I'll now make you the presenter so you can begin sharing your slides.
Thank you, Dr. Zakaria, for introducing me. Thank you all of you for having this opportunity to introduce the unused medications in Qatar homes. Hope you can hear me well.
Yes, doctor, everything is clear. You may proceed.
All right, that's fine. In our today campaign regarding the unused medication in Qatar homes, we'll discuss various stuffs regarding that, including the problems, strategies that we need to curb this or minimize the unused medications in Qatar homes. First of all, our slogan is say, remove the risk. Before that, let me introduce myself. As Dr. Zakaria already mentioned, my name is Mu'tasim Mekke. I'm a PhD candidate from the University of Malaysia, and I'm doing a research on unused medication, especially in Qatar homes. And I have published a paper on that, and I'm doing the second paper with regard of the development and validation of a tool for measuring unused medication in Qatar homes. It's already under process. So first of all, as I said earlier, remove the risk is the most important items in this campaign. So we have to remove the risk from the perspective of the healthcare providers and also from the perspective of the patients. First of all, let's have a little definition of the unused medications. These terms is used interchangeably amongst scientists. Some of them say that it's unwanted medications, and some of them call it as the medication waste or medication wastage. This is simply.
Sorry, Dr. Mutasam, would you be able to share your slides, please?
You cannot see that?
No, not yet.
I'm sorry. Can you see that now?
We can, yeah, just put it into presentation.
Okay, all right. Sorry about that.
Thank you.
All right. So as I said, our slogan for this campaign is that remove the risk or the harm that could be caused by the unused medications in our homes in Qatar. And this risk can be removed by the healthcare providers as well as the patients and health authorities also. As I said earlier, first of all, we need to know about the unused medication definition. This is simply the expired or the unused, unwanted medications or the leftover medications in our homes that we are no longer, in need for use, and we never care about them, so we put them aside, whether they're expired or not expired, whether they're damaged or contaminated or spilled. So this is, first of all, we have to, focus on the definition of the unused medications. And then we need to see also the reasons for unused medication in our homes. This could be also classified into two parts, at the level of the patient and at the level also of the healthcare providers. At the level of the patient, we can say that mainly the non-adherence is the main problem behind the unused medications. And this has a rise to around 50% of the medication being dispensed to the patients. Overstocking, especially during the hard times, during this hard, unprecedented time of COVID or Corona, COVID-19 pandemic, where people pile up many medications like zinc, multivitamins, and different other stuffs like antibiotics, to take care of themselves, fearing that this would be, out of stock in the market. So this also could be a cause for the unused medications at the end. At the healthcare provider levels, overprescribing, overdispensing could be also a problem. This is happened many times, can be seen in the private sector, where the overdispensing is seen for the profit of the pharmacy. Overprescribing also could be done intentionally or unintentionally amongst the healthcare providers, doctors and physicians. And also the medications that are due to expire when they are dispensed to the patients, they could also be, rendered unused at the end, because people will come to know that they are already expired when they want to use them. So we need also to counsel the healthcare providers regarding the expiry date of their medications. It should be dispensed at least 3 months before their expiry. Here we want to see who contributes to the unused medications. There are many multifactorial actually items behind this. Healthcare authorities could be a cause when they are not enforcing the laws against, the unused medications, or the regulations are not there. Patients is also the ministry, where the patients, as we said earlier, they're not adhering to their medications, and this is also will end up at medication being unused. Healthcare providers, when they overprescribe or overdispense, this also could be a cause. And the drug manufacturers or promoters, when they produce more than what we need in our society. So these four hands, like patient, healthcare providers, and manufacturers and health authority. By the health system, I mean the health authority, either in the hospital itself or at the top of the pyramid. That's the Ministry of Public Health or the Pharmacy and Drug Control departments. All of them, they should work jointly to curb this problem. And we also need to, many people may ask, what are the impacts or the effects of the unused medications? There are actually 4 impacts. This is what we call the adverse health impact. This is the most important thing. And also we have the ethical impact, which we will see at the end, and the environmental impact and the economical impact. Adverse impact could be shown by the children being poisoned in their homes, so the babies even. For the adults, they may use these medications easily, so that they may commit suicide or for recreational use. So there are many troubles happening. Alhamdulillah, that this is not happening too much here in Qatar, although we don't have enough statistics regarding this. And with regard to the economic impact, a lot of money is spent towards the manufacturing of medications, and still there are many direct and indirect costs towards the unused medication. First of all, let's see direct cost of the unnecessary expenditures that happens because we are processing and we are making medications, but at the end, people are not using them. And also the indirect costs, like, or when people do not use that, so they not improve their health, status. And this may lead to the, loss of manpower at the end also. So there is no work, there is no productivity. Disposal cost also at the end may cause a kind of a burden to the community when we need management, which will cost us a lot. And here in Qatar, many private sectors have used this in their interest by, managing this unused medication by cutting them from the patients or from the hospitals to the transplant to the plant where they damage that or they condemn them. And also we have the adverse environmental impact. It's also so clear in many states in the United States. It's been said that antibiotic resistance has increased too much when these antibiotics are not used, and they are also rendered, or they are, just flushed in the toilet, or they are dumped in the landfill. And there are many irritants that cause harm to the animals and different creatures, even the small insects. Estrogen also was found to cause a kind of intersex in the fish, where the fishes become neither male or female. And diclofenac also has caused many troubles to the liver and the kidneys. This was seen in Pakistan and India, where the diclofenac is used too much as a painkiller. You can also see that on the diagram. There are many explanations for this effects towards the animals and the cattle and the different live things. Also the blisters, or the the blisters that we use to cover up the tablets or the capsules, they also sometimes render may cause kind of harm to the environment. The last effect or the last impacts of the unused medication could be ethical, where we not use these medications, other people in the different regions, they may find it terrible, because they are in need of these even essential medications, but still they cannot use them because they don't have them. So we waste these medications, and we waste our ethics also. Let's play this video and you'll see this summarized of what we were saying. Hope you can hear it, doctor. Not hear that. I'm sorry about that. We may play it later because I tried from the source itself, but it still is not working. Okay, let's go to the proceed, or let's proceed to the second or the 10th slide. The disposal with medications. Through the literature, we found that garbage was the main destiny for medications. In Malta, for example, where we had Dr. Lona last week or a few days ago, we found that the garbage was the main stream for the unused medication. People just throw that in the garbage. Also in Cyprus, in Poland, in Qatar, if you notice that in the row before the last one, in Qatar also there was a study among the community where we found that garbage also was the main stream, or was the main destiny for the unused medications. People may find this accessible, handy, and they are sometimes careless, or they don't know about the risk that they cause by this unused medication. So they just simply throw that in the garbage. As you can see here, also the trash bins, where it's always around in our homes, we just throw that. Even pharmacists, in a study done in Kuwait, we found also pharmacists just throw their medications in the garbage. We would also like to have an idea about the status of unused medication in Qatar specifically. This is few researches done here in Qatar, and I've collected that so that we can just have an idea about it. We know that Qatar spent more than 1.44 billion Qatari riyals for medications in the year 2014. And most of these medications were branded, so they were so expensive and costly. Most of these medications were sold in the public sector, like the primary healthcare providers, primary healthcare sectors, and the Hamad Medical Corporation. And free medications also were caused, especially among our Qatari, they were cause of stockpiling, and at the end, they will now lead to the unused medication or medication wastage. Non-adherence, as we said earlier, also could be a big cause for this, the rationing prescribing and rationing dispensing also. And as I said earlier, in a study done in QB, Qatar Petroleum Company, amongst more than 1,800 personnel, they found also the garbage was the mainstream for the unused medications. We also continue on the state of unused medications in Qatar homes. We found that also in a study done by me and some other colleagues, the attitude and the practice, well, the attitude and the knowledge was fine towards the unused medications. People know about how to dispose them, how to use the medication, how to manage them. But when we come to the practice, we found that it was suboptimal actually. And these types of the unused medication found in the homes were mainly of three classes: the alimentary tract, on metabolism medications like pantoprazole, metformin, and also for the cardiovascular system, we found the furosemide and the statins were also among these medications. We have not used the anti-infectives, azithromycin, clarithromycin. These were found, too much among the people who were surveyed in this recent research. Okay, now we come to the ways of curbing these unused medications in homes. There are different levels where we can work on. First of all, let's have a look at the authority level. What I mean by the health authority level, the levels of the authority inside hospitals or inside also the medical companies or the Ministry of Public Health. We can improve the awareness of the public. We can also make a kind of program for taking back the medications from time to time. We can also enforce the unwanted medication policy. There is actually one unwanted medication return policy. It's there in the rules of the Hamad and the primary healthcare corporations, but it's not enforced in many places, and many people don't know about that also. Also, we need in the pharmacy and drug control department, we need to oversee the manufacturers, the volume of the manufacturers' medications, so that we can also control them. There shouldn't be kind of extra manufacturing, so that we also render unused at the end. At the manufacturers' levels, they can also help people by helping them out by giving kind of incentives, or by improving their awareness towards the collection of their medications and putting them in a specific area, so that these manufacturers can collect them at the end and take them to the landfill or for the incineration. We also can curb these unused medications at the level of healthcare providers, and this is a cornerstone. This is a very important side where we can work, because if we optimize the medications prescribing and dispensing, we can also optimize, the unused medications, and we can control that to a high extent actually. This also can be done by the medication use review As you all know, as healthcare providers, medication use review is so important in curbing down these unused medications. And also at the student level or at the healthcare provider level where there is a kind of a CPD, this may help a lot. And pharmacovigilance should be also initiated in different places. This also could be, it's not seen there in the military hospital, in the police hospital, because I kind of interacted with some pharmacists working there. They never do that, the pharmacovigilance. In some few pharmacies in the Hamad Corporation, we may see that. At the patient level, we need to encourage them by incentivizing them, even morally we can incentivize them. We can also teach them about the rational use of medications. This will help a lot to curb unused medications. So as we said earlier, the 4 levels that we can follow to curb down or to minimize the unused medications at the, if I go back to the last slide, at the health authority level, at the manufacturer levels, and then at the healthcare provider levels and at the patient levels. If we all work to being cooperatively, we can achieve our target. This is kind of a hierarchy for the overall waste management. There are main 3 steps. If we prevent, can reduce, we can also manage the waste. Prevention by the rational prescribing and dispensing, and this is responsibility of the healthcare providers. Reduction, this is by the reuse or recycling of unused medications. This could be done in the home care centers where medications are stored well on the hands of nurse, and they can be collected back and be reused in different regions of the world. And also for the disposal, medication, different medications, including syrups, capsules, and tablets, can be all collected in boxes where they can be taken easily and peacefully to the places where they can be condemned. I may also would like to add some takeaway messages. There are actually different messages that to be sent to the public and the healthcare providers, but I found these could be helpful to some extent. We as patients, we have to follow the healthcare providers' instructions regarding our medications. We also need to order enough quantity for ourselves, not more than that. And we have also to check before ordering. We have to keep the unused medications on the medication in homes in a safe place. Even if we want to use them or we want to discard them at the end, we have to keep them in a safe place away from the children and the kids or the pets. And also we need to, this is also recommended by the WHO and USDA. They recommend that medication should be taken back to the health authority or the pharmacy where the disposal would be fine. Or otherwise you can just flush them if they are in the flush list of the FDA. And also to work towards the national vision of Qatar for the year 2030, we can help use these resources efficiently by requesting them if we really need them. And at the end, and the last message, that we need to remove the risk. We all need to remove the risk, including the healthcare providers, the patients, and the health authority. I think I've finished with that. This is also kind of, sorry.
Thank you so much. Thank you so much, Dr. Mutterson. There's lots of questions coming in from our participants, so we'll move on to our panel discussion now. That you've raised many important points that our audience, they have some further questions on. So at this point, I'm going to now introduce our panelists again today. So we have Dr. Derek Stewart and Dr. Hisham Qureshi. Our first question, so I think in your presentation, Dr. Mutterson, you mentioned the concept of expired medicine. So I think the first question for maybe Dr. Hisham, would you be able to talk us a little bit about what we mean by expired medicines? What happens when medications expire, and what do we mean by this concept of expiry?
Okay, thank you, Dr. Zakaria, for this question. So basically, it can be when the drug or medicine become expired, it can be less effective, or sometimes might be more toxic, and it's basically based on kind of physical change or chemical change of the composition of some of the drugs or the component of active ingredient or even inactive ingredients. So please note that when I say that drug expired, it doesn't mean that it's become ineffective, but rather that it become like less effective. And this is because of that the drug or the active ingredient become decrease in strength or deteriorated. Now, the chemical changes or the physical change that associated with this expired medication usually associated with like a change in the color, a change of the taste, or maybe the composition of the compound, the drug itself in terms of like separation or become not homogeneous. Now, again, can I give you two examples here that we can give like the audience and what do I mean by expired medication? For example, like antibiotics. Antibiotics is a type of drugs that's used for treatment of bacterial infection. So in order to kill the growth of the bacteria, you have to reach a certain concentration or a certain amount of drug in the body. Now, being used an expired medication, which is supposed to have a less amount or less strength, that will not be able to kill the bacteria, and this is associated with like a treatment failure or maybe resistance. And the same example also when we talk about drugs that have a narrow therapeutic index. And what I mean by narrow therapeutic index is a type of drugs that have the margin between the effectiveness and the toxicity is very small. So any change on the concentration of the amount of drug because of being expired and becomes a bit degraded, it will associate with many a kind of treatment failure. Here also, I would like to just mention something very important that people might not get confused about expiration medication. So when I say medication is expired, it doesn't mean that all the time that the expiration date is passed, because sometimes you might have the drug is still not expired, but in fact it's expired because of improper storage of the medication. So Dr. Mu'tasim mentioned about that you have to keep the medication away from the children. Now we have some kind of, most of us we have a small pharmacy at home, maybe in the bathroom, and I think bathroom is not a good place to save these drugs because of the heat, because of the humidity. This will interact with the medication, with the solution, with the tablet, and end up having a change on the, as I mentioned, the physical and chemical property of the active ingredient. So the drug might be expired, but still not expired based on the expiration date. Yes.
And you've made reference there to the expiration date. Can you just help us to interpret, so say for example, we have an expiration date of October 2021. So does that mean we can continue using that medication until the end of October 2021, or should we stop at the beginning of the month?
No, basically when I say like October 21, then I should start like the last day before that month. So be like September, the last day of September would be the last day you can use the medication. And as I mentioned, because before that, this expiration date is the date that assigned by the manufacturer to maintain or to assure 100% potency without and safety of the medication.
Thank you. And just one further follow-up question regarding that. So to our patients then who are joining us today, what would you advise our patients who receive their medication from the pharmacy? Would you advise that they check their expiry date of the medication?
Yeah, absolutely. Yes.
Where would that usually be located?
No, if you talk about the expiration date, usually on the box of any medication, could be like a solution, could be tablet, could be whatever. Also, sometimes it's also the expiration is clear within the package of the tablet itself. So I advise the patient and the public to look at this expiration date, and you have to, and as I mentioned, Dr. Mu'tasim mentioned before, you have to even just stop using 3 months before the expiration date.
Thank you very much, Dr. Hisham. So another point that was covered in Dr. Mu'tasim's presentation was the concept of inappropriate disposal of medicines. So Dr. Derek, can you tell us a little bit about why is it important to dispose of medicines correctly?
Yeah, I mean, well, if you think about it, medicines in a way are, quite dangerous substances if we dispose of them in such a way that anyone can access them. So if we put them in the dustbin and the garbage, anyone could get access to that, children, pets, relatives, old people, young people, absolutely anyone. So we really need to make sure that we are disposing of them in the correct way, and really to take the advice of doctors, pharmacists, in terms of how to dispose it. I mean, I've recently come to live in Qatar from Scotland, and there's a difference to how we would dispose of it, going back to community pharmacies there that you might not do here. And I think with this country having a large expatriate population, you can't just assume that what you would have done back in your home country is exactly the same that you would do here. So we really need to protect everyone from those medicines, and throwing them down the toilet and the dustbin, these are not the correct things to do. The other thing I was just going to add about expiry date, the other thing to watch out for that can be quite difficult is there might be an expiry date in terms of the product, but it might also say things like discard 1 month after opening. So there might be a different expiry date in terms of the actual usage of something. It might be because of the preservatives, lots of different reasons. It might be chemically unstable once you actually open it and start to use it. So don't just go by, as Dr. Hisham says, the expiry that is written as the expiry date. There might actually be instructions with the product as well at the point to stop using them.
So again,
yeah,
sorry, Dr. Hisham.
I'm talking about still about the expiration date. Yeah, I agree with Dr. Derek that we don't have to stick with the date, but again, maybe I agree with Dr. Derek, some medications that maybe they have a long expiration date, but once being used, it become lose their some of the effective. For example, like antibiotics, most of them, like in a powder form, they have long expiration day, but once being reconstituted, and then you have only 2 weeks to use. So this is an example of that. You don't have to stick with this now at this date. Also for some of the eye drops, it's maybe have a long expiration date written on the box or the tube. But once it's used, like you cannot use more than 2 weeks because or certain time, it depends on the pharmacist instruction or the physician. Otherwise, you might have increased the chance of having a kind of bacteria. So yes, we have expiration date for. Like I mentioned, have to mention that the expiration date in the bottle is for unopened medications. But once opened, there will be a dramatic change on the drug, and you might have to go with another expiration date, as I mentioned before, based on opening, after opening, or after constituting that compound with the water or something like that. Thank you.
So it does sound like it's not so straightforward regarding the expiration date. So what would you advise our patients? What resources are available to patients to help them to understand when their medications are likely to expire? So Professor Derek, can I put that question to you, please?
Yeah, I mean, definitely read the information that we package inserts, ask in the pharmacy, ask at the doctors. I think if it is something that you have to stop using after a certain point of time, write that date on the label, write it on the package, the date you started using it, so you know that you can only use it for 2 weeks, 4 weeks, or so. And there aren't that many medicines that will be like that, or sort of types of medicines, but do watch out for it.
And I guess the pharmacist and other healthcare professionals will be able to give that advice also.
But it will tell you that in the pack. It will tell you what the expiry date is, and if there are other instructions in the usage, you know, that you need to stop using at a certain point in time. But it's really easy to forget. So if you write it down and, you know, put it in your phone, whatever, the point that you should stop using that particular medicine.
Thank you. So Dr. Mu'tasim, Professor Derek mentioned the method of medication disposal in Scotland. Could you maybe elaborate on the practice that's recommended here in Qatar, please, for our patients?
Thank you, Dr. Zakaria, for this question. First of all, let me just mention something. We noticed that people here in Qatar, in different also Arab countries, they just believe that medication should be kept in the fridge, in the refrigerator. And this is not always true, because some medication need not be, you know, get moistened, or should be away from the moisture. So this is a kind of also false concept that we as healthcare providers, we have to change this concept. With regard to your questions regarding disposal here in Qatar, as I mentioned earlier, we found that most of the people prefer the garbage, the home garbage. For this, they find it at hand, accessible. They are kind of lazy. That's what we noticed from them, and they were so clear when they talked to us regarding this. And there was no instructions from pharmacists or the doctors regarding the right disposal of their medications. So people prefer putting that just simply in the garbage or the trash bin. And people who were educated, especially of university level, we found also in our study that some of them, they were less than 30% of them who used to take their medication to the nearby pharmacy. So we can say that the whole community, or a large volume of the community take this medication to the trash directly.
So the ministry, they recommend that patients should take unwanted or undesired medications to community pharmacies. Is that the only place where they can take these medicines, or is there other places as well?
According to the internal rules of the PHCC and the Hamad Medical Corporation, people that can bring their medication back to this pharmacy, to the public pharmacy. But with regard to the community pharmacy, there is no rules on that. But still, there are some pharmacists in the community, they accept these, out of the law. But for Hamad Hospital, pharmacists receive that, and they put them in a different window, in a different cartons, where they write ready for condemnation.
Okay, so just to confirm, then patients can take their undesired, unused medications to the Primary Healthcare Corporation. So I would imagine they go to the pharmacy department within the Primary Healthcare Corporation, and probably put the bag safe in a carrier bag and hand it over to the pharmacy staff within the pharmacy department.
Yeah, you're right. They should take this medication only to the public hospital, to the public pharmacy. Yeah, okay. But not the community pharmacy. And this also could be a suggestion in the future that nearby pharmacy could help a lot, because people may find it so difficult, tedious to go back to the community, to the public pharmacy, where they're sometimes away from them.
And does that apply to all medicines? So tablets, capsules, liquids? Is that all medications are included in that?
Yeah, for sure. All medications should be taken back to the public pharmacy. For the kind of liquid medication, they can be mixed with some litter or some. Yesterday, I noticed that in Fairfax County in the United States, you can put that in a zip plastics, where you can also insert a kind of tissue paper along with the liquid. So this will be absorbed, and you can add some coffee or cat litters or whatever, and you can also dispose this in a trash or flush. For the flush list, as I said earlier, the FDA has a flush list where especially narcotics and psychotropics, opioids, and so can be flushed there, because by this way we can, get rid of that while taking care of our kids and our adults.
Right. Okay. And just one follow-up question regarding that. Are patients incentivized at all to return their medicines to the Public Healthcare Corporation or to the public hospitals?
Unfortunately, there is no incentive for that. But there could be kind of more incentivization from the pharmacists and the doctors when they encourage their patients to bring these bags, to keep our land clean and our environment perfect. But there's no actual or formal incentivization for the patients.
The reason I asked that question is because, like many of us, I'm sure we have a stock of medicines at home, and I would be concerned if I turned up to maybe one of the pharmacy departments with a bag of medicines, that maybe I would be judged by the pharmacy staff there, or maybe there would be a comment. Is that something that I need to be afraid of at all?
Well, this is a positive point. If you take it back for the pharmacist, you can make a good relation with him. And I think this would be good for counseling and for you reviewing your medications. You'll have a good relation with this pharmacist specifically, so they may help you in the future. And I think that they do appreciate this kind of practice.
Okay.
If I can just come in there, I was going to say, I think if you find that you are handing back a lot of medicines, you need to be thinking about why, and could you stop that in the future? You know, have you over-ordered prescription medicines? Are you buying too many over-the-counter medicines? So rather than just continually stockpiling them, to think about what's the actual need for the medicines. You know, it's impossible to eliminate all waste. You know, some medicines, some inhalers, people need to carry with them just in case they need them. So they might well go out of date without being used. So we're never going to get to a situation where there is zero waste. What you want is the minimal waste. So as I say, if you find that things are stockpiling all the time, don't just clear them out and restock them. Just think about what do we actually need to have in terms of prescription or medicines that you would just buy in the pharmacy or the supermarket.
So, in your experience, Dr. Derek, I mean, what would be the typical reaction of pharmacists or doctors when patients they do come back returning large quantities of medicines? What is their reaction? What's their response?
And I don't think there's a standard reaction, but I think any health professional is really going to be starting to think about why. And it's maybe not just the patient, it's maybe the health professional prescribing too large quantities. You know, if you start a new medicine for blood pressure, you maybe only need a small amount to see if you're going to tolerate it, to see if it's going to work. And if you then prescribe a large amount, then we need to think about why. But we do need to think, particularly if people are bringing large quantities back, when we see them and consult with them, either in the doctor's practice, the surgery, or the pharmacy, are we actually spending enough time with patients to find out how they're actually taking their medicines? Or do we make the assumption they're taking them and that they're not working, so we prescribe higher doses, we prescribe additional medicines as well? So certainly years ago when I worked in hospital, it wouldn't be unusual for bags of medicines to come in, you could see it never being used, and the doses going up and up and up. So patients were being prescribed a higher and higher dose on the assumption that they are taking the medicine, it's not working, so I need to give them more. And the patient was never telling them, well, actually, I don't take these, I don't like them, they don't suit me, they don't work for me. So I think, you know, it's not always just the patient who's almost the culprit for all these medicines piling up. It's maybe the whole system that we need to look at there.
So thank you, Dr. Derek. So you have mentioned the role of the patient there. So other than maybe being aware of the quantity of medicines that they have at home, when they're interacting with a clinician, what sort of information should they be ensuring that they have before they leave the physician's office and go home?
Well, I think they need to understand why these medicines have been prescribed or recommended for them, how they're going to use them to best effect, and then what to do if they're not working or they're experiencing, you know, key side effects. You know, every medicine will have the potential to have side effects. We need to understand the ones that we need to act on and alert someone else and do something about them. But there's no point just going away with a prescription of medicines thinking I'm definitely not going to take this anyway, but I'm just going to take the prescription for you. So there needs to be that really exchange of ideas and thoughts on the medicines. So there's some sort of combined decision about the plan for taking those medicines.
Thank you. Dr. Hisham, we have a question for you. So one of our participants has said that they keep hold of their medicines just in case they need them again in the future, or a family member needs them in the future. So Dr. Hisham, would you be able to maybe respond to that?
So the question is like whether can we reuse the medication for other member of the family?
Yes.
Absolutely no. If the medication has been prescribed for one of the member family, it was being prescribed for based on his condition, his disease. So we cannot. It's not really recommended to reuse the same medication for other person of the family. The second point, Abe, I'm not sure about. Maybe if we can link this with the medication expiration. Of course, no. even though it's like a borderline. I mean, like even one few days before, I mean, after the expiration date, it's not really recommended. As I mentioned before, the chance of having a risk of safety risk is high with using of these medications. So another point also might also be I can talk about here is the storage. As I mentioned before, it might have a drug that being used for one of the member of the family was improperly stored in the house, and then if we use it again, reuse it again for the same person, it might not be a good idea, because we who knows, maybe the drug is not become like effective or less effective. I mean, because of the expiration and the improper storage. Yes.
So I guess your advice would therefore be, if you do have a member of family who is unwell, then they should really be going to a healthcare professional in order to make a formal diagnosis and
get advice and seek medication.
Thank you. And Dr. Muttasim, I think you mentioned in your presentation about donating unused medications, and that there's an ethical situation here where the fact that maybe in Qatar we do have large amounts of medication waste, and there are countries around the world that unfortunately they don't have the same provisions we have here. So it does raise this ethical question: should these medications be thrown away, or could they be used for another purpose?
Thanks, Doctor, for this question. Let me go back and just comment on Dr. Derek, what he said regarding the unused medication in homes. We found that also there's not enough time spent amongst the healthcare providers when they sit down with their patients. I mean, they are so busy with certain programs, the software in their hospitals. This program takes a lot of time of them, so that they cannot focus with the patients, and this also would reflect on the patient's use of the medicines. So I think if there is a kind of a real consultation or a real MUR, medication user review, this will help us, decreasing these unused medications. So we need to adjust this certain software. It takes a lot of time, because I have some friends from doctors practicing here in Qatar also. They said that before these programs introduced, they were they had enough time to interact with the patients. This one point. With regard to the donation of the medications, there's no actually recommendation towards the donation of any medication, especially from the WHO and FDA, and even here in Qatar. But there are some special circumstances and conditions where medications can be recycled or reused in some other regions. We found that in Qatar Crescent organization, they collect these medications, but not from the patient, from organization which they trust, where the medications are stored well and appropriately, and they take this medication to countries with low incomes. Also, some embassies here in Qatar, they work jointly with the Ministry of Public Health, and sometimes they get some medications to their countries. And also, as I remember, there was a kind of donation when there is any crisis in different places around the world where the medications are donated. But with regard to the patient level, there is no donation at this level, because we are not sure about their storage condition.
Thank you very much, Dr. Muttasim. We do have a further question from our participant, and it's around, is there a penalty for improper disposal of medicines in Qatar?
There is no specific penalty for that, but if you dump any waste outside the allocated place, you will be fined for that, but not specifically for the medications.
Okay. Thank you. Okay, so Dr. Derek, just reflecting on your practice in Scotland again, because we have one of our participants who's mentioning that if there is these take-back schemes to pharmacies, maybe patients, they will have doubts that pharmacies will reuse these medicines. So are you able to maybe talk a little bit more about your experience in Scotland?
I mean, certainly in Scotland, that would be against all professional and ethical standards, so it would be an issue for actually professional misconduct. I mean, once a medicine leaves the pharmacy, in the UK, we have no guarantee over how it's going to be stored, what's going to be done to it. So when you then bring it back into stock, that expiry date, if the medicine has been taken away from the pharmacy, stored at way too high a temperature, that expiration date may no longer be appropriate. If it's a liquid, we don't really know what could have been added into that liquid, how it could have been used. So certainly in the UK, the legislation will prevent any reuse of medicines. It is quite difficult because from an economic point of view, you're then disposing of medicines, which are not always inexpensive, but we need to be assured of the quality of those products. So there wouldn't be any reuse of medicines once they'd left the pharmacy in the UK. I'm not sure about the practice here, but certainly that would not happen. Or if it did happen, it would be a case of professional misconduct.
Dr. Mutasam, would you like to add to that? Because I believe here as well within the QCHP, the Qatar Council for Healthcare Professionals, all healthcare professionals, they're registered and they're bound to this professional code of conduct, as Dr. Derek has described, is in Scotland as well. So I think patients, they can be reassured that if they do or when they do return their medicines, then they're not going to be reused, and that the medicines they do that are issued to them by pharmacies, that they are safe medicines and that they haven't been dispensed previously to any other persons.
I believe this should be also done, as Dr. Derek said, but it's not happening actually. Pharmacists themselves need to be educated before the patients. And in this regard, if the patients trust the pharmacists or the healthcare providers, things will go smoothly. I believe so.
So the next sort of topic that I want to just discuss now, and we received some questions from our participants regarding this, is what further efforts can be taken both on an individual level, on a system level, to improve the issue of medication waste here in Qatar. So Dr. Hisham, can we start with you, please?
Sorry, can you repeat the question, Dr. Zakaria? I didn't hear the question.
Yeah, so Mr. Mutasam, he's made us aware of some of the efforts that are currently taking place here on Qatar to address the issue of medication waste and to reduce the burden. What in your experience and with your knowledge, what more can be done to address this problem?
Okay, there's several factors we can have it in order to reduce the burden and reduce this issue. Back to Dr. Mutasam mentioned before about that return policy, like is only implemented in Hamad and most of the governmental hospital, but not in the clinic pharmacy. Like in North America, they have what they call drug take back days. So if there is like a kind of national day in the country where they have like a kind of big containers in these community pharmacies, and where where people like they can return their medication, expired medication or unused medication, and these containers could be taken later on by one of the governmental agencies, and this will reduce the burden. This is number one. Number two, I think the dispensing medication for a long time, or refill without having proper follow-up with the patient. This is be another fact we have to be taken in consideration in terms of refill the medications. Another point also is like, as I mentioned before, or maybe earlier, I have to do it again, is regarding the storage of, I think the people, the patients and the public have to be aware of the right and the correct way to store the medication. They have to read carefully the medication leaflets and to see, and again, to have to follow the instruction by the pharmacist where they to put it. As I mentioned again, that I'm not sure that having a small pharmacy or container or cabinet at home in a wrong place, can affect the expiration and affect the effectiveness of the medications. So this is some of the factors that might be taken in consideration or to reduce the burden on the patients and this issue.
So in summary, then, you've mentioned the concept of take-back days, where
yes,
there could be a day that pharmacies encourage patients to bring back their medicines. You also mentioned the concept of regular reviews. So patients, before they receive their refill, they should have a review with their physician to ensure the medication is.
That's again, maybe I like ask Mu'tasim about any reason from your study why this kind of return policy was not implemented in the community pharmacy.
Sure, doctor. It could be kind of, I don't want to say kind of carelessness, but this is what's happening actually. Few people would know that there is a kind of return policy, and I think this kind of happens among the expatriates here in Qatar and also some different Gulf countries, because we've seen that also in the literature in Kuwait, Oman, and different countries around us. And I just want to add up on your points regarding the curbing of unused medications and the management of the disposal. We can also, Dr. Zakaria, we can also add or disperse the boxes for the collecting of these unused medications. If we circulate this in different regions, people can access that and they can return these medications, I believe so.
Thank you. And I have the same question to Dr. Derek. So, Dr. Hisham, he's mentioned a few potential initiatives that may be suitable for this local context. Is there anything that you can add?
Yeah, I mean, there's so many studies and evidence around medication waste and what gets disposed, how it's disposed. And so we know it's a big issue. I think we do need to turn it around. Dr. Hisham sort of alluded to, I think we need better use of medicines, more awareness around really respecting medicines, thinking about, good prescribing practices, people being really informed about how to take medicines, when to take them, how to really get the best from them, what side effects to watch out for, so we can try and reduce the amount of waste. So I think it's almost shifting the focus to the safe disposal of that waste, to can we raise awareness around the safe disposal, but can we put efforts into raising awareness around how to use medicines to be most effective, to have appropriate quantities of medicines so that they are not collecting in people's cupboards, not being used. The next time you go to the supermarket, do you really need all the boxes of paracetamol, cough medicines, things from the pharmacy, or do you need to buy the amount that you really need? And then we should have less waste accumulating. So I think it's turning it round from the focus on waste to the focus on appropriate use.
And I think that aligns with one of the questions that we now have from one of our participants. So the question is, would you consider intervention at the level of healthcare professional through educating the patient as a potential effective strategy?
Definitely, and I think empowering the patient, the patient's in charge of their medicines. So the patient should be starting to think, these medicines aren't working, I don't need many of them, I think I'm going to get a side effect, I need to speak to someone about that, and how much do I actually need? And I think, practices may be different in this country. I got a prescription for 10 antibiotic tablets and I was dispensed 20 because the pack size was 20. Now that maybe is practice here, it wouldn't have been practiced in the UK. So I ended up with 10 antibiotic tablets that are sitting at home that I didn't need because I had to stop taking it after 5 days. And that almost encourages me to think, next time I've got an infection, I've got those antibiotic tablets, which is not appropriate. So I think we do need to think all about appropriate use of medicines.
And you also mentioned there patient empowerment. So maybe you could elaborate on that. How can patients be more empowered, become more empowered?
Well, I think it is the patient that's being treated, or the person, the individual that's being treated. So for them to almost be in charge, maybe not making the decisions over which medicine to prescribe, but how those medicines are going to be managed. So if something is going to be given to you 3 times a day and you're not going to manage to take it 3 times a day, to actually speak about that during the consultation. So the medicines that are prescribed might fit with you and your lifestyle, so you're more likely to take them. So rather than just almost being quite passive in that consultation, but actually just taking them away and being much more empowered as part of that consultation and really being in charge of those medicines.
Thank you, Dr. Derek. Dr. Hisham, you being in the College of Pharmacy, you'll be aware of the curriculum and the training that the pharmacy students receive regarding the management of medicines and advising patients. So maybe you could elaborate more on the pharmacist's role in advising patients.
Yeah, actually, that when we talk about medication expiration, I think that the pharmacist is the only one and the most expertise, one of the professional healthcare professional in terms of dealing with the drugs. So the role of pharmacist is big in that particular issue. In terms, first of all, in terms of the advising the patient or giving instruction to the patient about the, in terms of the proper way to store and to use the medication, and again instructions on how to use the medication, and in terms of the expiration date, in terms of, again, as I mentioned, the expiration after opening or reconstituting medication. Second point is about the role of pharmacist, also in terms of the advising the patient of the how they will handle the medications, and the advice for those people about the improper way of reusing or reusing the medication for another member of the family. Here in College of Pharmacy, we also have some toxicology courses where we also give the students some of the information about the toxicity of certain drugs, and absolutely this might be linked also with the drug expiration. As drug expire, the chance of having risk of safety risk is also high. And also I can add that also the pharmacists here and the pharmacy students after graduation will be able to give the patient and proper, the best way to describe the sign, I can say, the indicator of drug expiration. Maybe the change of the color, maybe the change of the taste, maybe the change of the composition, the shape or the function, the composition of the medication. I think this could be the only pharmacy can all do this stuff.
They sound like very useful resources in this regard then.
Yes, we have mostly, you mean to talk about resources for this information?
No, I'm talking about the role of the pharmacist.
Yes, absolutely, yes. The pharmacist is the only one, as I mentioned before, among the healthcare professionals, they can provide all these type of resources regarding the medications.
Thank you very much, Dr. Hisham. Dr. Mutsam, there's a question for you here. So you've described some of the research that you're involved in, and of course, the purpose of doing this research is to inform changes and to better our practice. So what would be the implications of the research that you are involved in?
I hope this research may help the situation of the unused medication in Qatar, if it's taken by the health authority, especially in the Ministry of Public Health. If they take care of this, and if they increase also the kind of research done on this area with the kind of funding, this may help a lot in curbing these unused medications. I'd like also to add another point to these promoters. We have to take care of the promoters of the medications and the manufacturers. We all know that part of their job is to increase their sales, and this will come account on the patients. By hammering on the healthcare providers to increase the sales or the writing as much as they can. So they may be incentivized, or they could be kind of perverse workout. This also will increase the pileup of these unused medications in homes. So promoters should be also be encouraged to follow the ethics. And also this practice will help, as we said earlier, the environment, the economy, even the economy of the community, on the individual economy, and our safety of our children and kids and pets inside the homes.
And a more specific question then, in terms of curriculum reforms, so for pharmacists and even maybe for other healthcare professionals, what impact do you see that your research will have on curriculum?
This may help in the curriculum if we follow that in our bachelor degree curriculum. So if we teach all healthcare providers regarding these unused medications and know how to, follow the strategies of the pharmacovigilance and medication use review, this will help a lot if we include that in our curriculum. Even for the schools, people in the schools, they can be encouraged. Kids from the young age, they can be taught these are waste of resources.
So you're encouraging, you're advocating for this education to start at much earlier than university level?
Absolutely right.
Thank you. I think we have one more question, and for Dr. Hisham. So, Dr. Ahmed, he likes your idea of the dedicated day for the return of unused medication. How can the College of Pharmacy here at Qatar University, and indeed other stakeholders, contribute towards something like an initiative like this?
I think this is a very good question, and I was about to mention that about we have to involve the College of Pharmacy. Now, I think, in my opinion, we have two ways we can. I can see the role of College of Pharmacy here. Number one, I think we might have one of our campaign in terms of the awareness of the people about the importance of medication return. I think the College of Pharmacy, as the only College of Pharmacy in Qatar, they might or they have to coordinate with the Ministry of Public Health and other stakeholders to have some of the containers and to communicate with these community pharmacies. And then we also might involve our students for this kind of activities. And I think the second point, maybe we might have conduct a kind of agreement with the Minister of Public Health, or maybe a kind of research in terms of see what's the barriers of implementing this kind of back day in Qatar, and what's the challenges that we have. So I think this is maybe two I have it down in my mind to see the involvement or the role of College of Pharmacy in this particular idea.
Thank you, Dr. Hisham. And Dr. Derek, is there anything you'd like to add to that point in terms of the role of educational institutions to address this problem?
I think we need to make sure that all of our students, as they become practitioners, are really focusing on these issues. And I think we've got an excellent opportunity to do that in an interprofessional education way at Qatar University, with all the work that is done on interprofessional education, and just highlight that and get the students to think that as a multidisciplinary team of different practitioners, how they can all play a part in that. So I think there are things that the students could be doing in terms of campaigns and the student-led work, but I think there are things that we can do with the students, so as they go into practice, they're in a much better position to be thinking about medication waste. Because it's maybe not something that we explicitly teach across all the different programs. It's almost hidden amongst what we do, and it's just raising that as a key issue.
Thank you. I think that's all the questions we have from our participants, unless anybody wants to add any further questions. So we're monitoring both YouTube and WebEx. Thank you for everybody's participation today. There's been lots of questions, and I think our speakers have done very well in responding to those questions. So I'll give it a few more seconds to see if anybody else has anything else to add. But I'd also like to just take this opportunity again to thank the organizing committee for making this event happen. I think it's a very relevant and important initiative, and I hope it's the first of continued efforts to address this very important issue. And thank you again to our speakers for supporting this event, so Dr. Derek, Dr. Hisham, and Dr. Mu'tasim. And thank you as well to our participants who are making their voices heard now. So thank you very much, everybody. And we as the College of Pharmacy, we are always happy to collaborate and to offer similar initiatives going forward. So if there is other areas in which you would like to contribute and you have ideas that may be effective in addressing this issue, then please get in contact with us. Okay, thank you very much, everybody, and I look forward to seeing you again soon.
Thank you.
Thank you.
Thank you, Doctor. Thank you, doctors.
Thank you, Dr. Mu'tasim. Thank you, Dr. Derek. Thank you, Dr. Zakaria.
Thank you, Dr. Hisham, Dr. Derek, and Dr. Zakaria.
Good luck in your studies, inshallah.
You too, inshallah. Thank you, doctor. Inshallah, we'll try to meet one day, inshallah.
Inshallah, of course, absolutely, inshallah.
Inshallah, doctor. Thank you very much.
Bye-bye.
Salam.